I'm here today with Dr. Susan Vasko, and we're going to delve into the world of fillers, injectables, Dr. Vasko, because there are kind of a lot now. People may just think Botox immediately, but that's not the case.
It's not the case at all. Botox, probably one of the first injectables, has been around about probably at least 30 years, and FDA approved for cosmetic use much more recently. But Botox is great in certain areas. The frown lines, crow's feet, things like that. But it's very different from a filler, which accomplishes different goals.
Would somebody be in a good position, I guess, to get fillers first before maybe trying something more invasive? Is that a good place to start in the aesthetic world?
We see women have fillers for lots of different reasons. Some are just young women, their face looks great, but genetically they're kind of programmed to have the deep lines through here. So they're a nice candidate for a filler because you can fill in those lines, it's non-surgical, it is just, you come in the office, you have your filler, you walk out, you can go to lunch, there's no recovery or things like that.
You mentioned Botox, but there are so many new ones and different ones that have come out on the market. So talk about a couple of the most popular.
Well, a couple of new non-invasive treatments for facial aging are Sculptra and Voluma. Sculptra is one of the newest fillers. It's a Juvederm product or a hyaluronic acid product that is really made for the mid-face. So we have these little apples of our cheeks area, and that can get either born so it's not very prominent, or over time the soft tissue kind of descends on your face, and so you can kind of plump up that area with Voluma. It's a nice product, lasts FDA approved to last about 2 years. And you come in, you have it done, you walk out, and you look great, so you're done. The other product is Sculptra, which has been around a couple of years. It works differently than a filler. It actually stimulates your body to create soft tissue. So I use it in a couple of different settings. One is the younger ladies, especially bodybuilders, that don't have a lot of body fat and their face is looking a little older because of the loss of soft tissue. The other group are the other end of the age spectrum, where maybe you're in your 70s and you really don't want surgery, but you're losing a lot of soft tissue in your face, and having Sculptra to rejuvenate that soft tissue and fill out can give you a much more youthful appearance as another non-surgical treatment.
Because as you age, you get hollow. I
Yes.
mean, things kind of just don't plump up the way they used to.
Correct.
And so this is a good way to make the appearance of that and really generate your own collagen.
Correct.
Okay.
Yeah, exactly.
And I noticed these results are lasting a lot longer. You mentioned 2 years. This isn't a monthly thing that you have to come in and keep getting treatments.
Correct. And that's a huge advantage because people are really looking for things that last longer than coming in 2 or 3 times a year to get an injectable. When you can have a product that's going to be around a couple of years really makes a nice difference for folks.
So the recovery, not bad at all. The results last a very long time compared to what they used to. So this is a really great option for a lot of people looking for just maybe a little fresher look.
Correct. Yes.
Okay, Dr. Vasko, thank you so much for being with us.
Thank you for having me. I appreciate it.